When I gave my AMC clinical exam, there were two stations that I was really confident at. I thought that I've ticked off almost all of the boxes and I'm going to nail these two stations. And the other stations, I knew that I made a couple of mistakes here and there. But when the results came out, I had failed two stations, and these were the exactly two stations that I was confident at. Why did this happen? There's a concept of recalls bias in AMC clinical. My name is Andrew, and over the last few years, I've done a couple of OSCE exams that has given me insight into these concepts, such as the recalls bias that we're going to discuss today. So, what exactly is recalls bias? In simple terms, recalls bias is your brain's tendency to jump to conclusion because you already know what the case is about. So, you naturally don't ask the set of questions that you otherwise would have just because you know what the case is. And so this recaller's bias is picked up very easily by the examiners. Examiners of AMC Clinical have also mentioned it in the tips from examiner document that they released. And so it's very easily picked up by the examiners. How to avoid it? So I've come up with a couple of things that we can do to avoid it. The first one is really simple. Once you go into the station, just make sure that you have this idea in your mind that AMC can make a small change in a chief complaint or in a symptom, and then the entire case is going to change. So if you think that the station is going in a particular way, you should have it in the back of your mind that there can be a small change, and AMC has been doing it a lot. The second thing you can do is, once you're doing a practice with your practice partner, give them a different case. So if you're doing chest pain, okay, and you're doing this cluster with your partner, while doing it, make that case to be a GERD case, and so give them an abdominal case. Give everything same, but just wait if they ask about acid reflux, about water brush and things like that. And if they don't, give everything as normal and just let them fail the station while you practice it. Another example can be, if you're doing musculoskeletal and lower limb cases, give them DVT. DVT comes in CVS or respiratory cases. But if you're doing musculoskeletal, just let them ask you if you have any recent travels, if you have any shortness of breath along with the pain as well. And so while you're practicing, make small changes here and there so that you are always aware of a case to be different than what you're expecting it to be. And once you're about to enter a station, just keep that in your mind that this can be something else. This can go in a totally different direction. I need to cover almost all of the possible aspects. I hope this helps you.